Good morning, dear students. The topic is varicella zoster virus. Aim and objectives: student able to know list of the common viruses causing viral exanthemas. Students able to describe pathogenesis and laboratory diagnosis of varicella zoster virus infection and prophylaxis of chickenpox. List of the common viruses causing viral exanthemas: herpes simplex virus, that is last class we have discussed. Today, the varicella zoster virus, and next short video I will post, that is Epstein-Barr virus. Other viruses causing cutaneous and mucosal presentation: pox viruses, parvovirus, human papilloma virus, measles, rubella, poxaki, and viral hemorrhagic fever, like dengue, chikungunya, and chandipura, and others also. First, I want to describe one small clinical case. A 20-year-old student presents with fever and generalized maculopapular rash resembling dewdrop. Prior to this, there was a severe headache with generalized pain. The rash was more on the foot trunk. When we observe, rash started from the trunk and then they spread other parts of the body and proximal part of the limb with small papules, vesicles, fistulas, and crust. These are the lesions. Fine petechial hemorrhages were noted on the right onset. The keywords on this in the clinical case: generalized lesions, one, were mostly on the trunk, resembling in the dewdrop, superficial lesions. But the superficial lesions mostly commonly occur in children, and in 20 years, mostly in adult, they are involvement of the deep layers of the skin and deep seated lesions. So dewdrops mostly the presentation in children, but it may be maybe sometime occurring in adults. So due to dewdrop appearance, maculopapular rash, all types of lesion and originated from the trunk. Possible it is a case of chickenpox. So what is actually chickenpox? Which we discuss pathogenesis and laboratory diagnosis. It's caused by the varicella zoster virus. Again, the classification of herpes viruses as alpha herpes viridi, beta herpes viridi, and gamma herpes viridi. In alpha herpes viridi, herpes simplex 1 and 2, and varicella zoster virus. Morphologically similar to herpes simplex virus, it is a double-stranded DNA virus, envelope virus. With envelope size is 200 nanometer, and without envelope it is 100 nanometer with nucleocapsid. An envelope derived from the post nuclear membrane. Chickenpox, the name again is not a relation with direct with the chicken or poultry. It's not transmitted by the chicken, but the lesions when we observe on the patient, its appearance like when the chick fed on the ground. When the chick fed on the ground, the area is similar with the lesions present on the patient. So they known as chicken pox. These types of lesions. The points we discuss in pathogenesis: source, mode of transmission, spread, agent host interaction, incubation period, and clinical presentation. And the source is the human being. The lesions are mostly present in the mucosal layer and cutaneous lesions. In early phase of the in the patient, the virus is more present in the respiratory tract, upper respiratory tract. When a disease progress, the severity of the infection is decreased and infection rate also decrease. In early phase, viruses are more abundant present in the upper respiratory tract. That is the main source. Second source is the lesions present in the cutaneous lesions and mucosal lesions. Contact. The infection is mostly transmitted by respiratory tract inhalation. Because the viruses are present in the upper respiratory tract in the patient or carrier, when they cough and sneeze, they spread the viruses in the air and through conjunctiva or respiratory tract inhaled by the other person and enter into the body. Through the lung, they enter into the blood and cause viremia. And they, from the blood, they disseminated throughout the body. But target site is the superficial skin and mucosa. And in the skin and mucosa, in most of the some patients, they present clinically by incubation period is 1 to 3 weeks. There is a cutaneous and mucosal presentation. Some patients are asymptomatic and the viruses remain latent in sensory ganglia in vertebral column for lifelong and then reactivation in future life. Latent infection is characteristic features of herpes virus infection. Entry to the inhalation, viremia, and target site. Target site is the cutaneous and mucosal lesions. All the types of lesions we observe in the one patient because the lesions in the children are mostly superficial, so they appear in dewdrop. This is the crust, dewdrop appearance. Dewdrop appearance. Why? Because the involvement of the superficial layer of the skin. So there is no deep layer of skin layers of the skin involvement. So lesions are the, like a dewdrop. And when you eat without any scar mark in the children, and lesions eruption is very rapidly. So all the types of lesions we observe on the same patient at the same time. Macule is a discoloration, papule is elevation, then they form vesicles, and then pustules. Vesicle means accumulation of the clear fluid, and the clear fluid become turbid. It is called pustule, and after pus they form crust, an ulcer, and then ulcer get healed. It form crust, and it heal without any scar mark. The all early eruptions are rapidly eruption of the lesions on the same patient. All types of variety lesions we can observe on patient. Again, second characteristic feature of chickenpox, they start from the trunk. So there is a centripetal eruption of the lesions compared to the smallpox. Now it is eradicated. It's centrifugal. Most of the lesions peripheral part, face and limb. Here, most of the lesions start from the rash, start from the trunk. So that is one of the characteristic feature of chickenpox. Generalized lesions, mostly common in the children, with a macule, papule, vesicle, pustule, and crust. All types of eruptions may occur. In the children, chickenpox is a symptomatic or mild form and heal without any complication. So we can say chickenpox is good in children. Chickenpox is a primary infection caused by varicella zoster virus, and it may be occurring in adult. But in adult, compared to children, it is severe or very serious infection associated with different types of complications. Lesions also involvement of the deep layer of the skin. So there no dewdrop appearance. That is the involvement of the other layers, deep layers of the skin. So when the lesions heal, the pitted mass or scar mass left. Second is mostly associated complication. Most commonest complication in chickenpox in adult is pneumonia, secondary bacterial infection or its viral infection. Pneumonitis or secondary bacterial infection, pneumonia. But it may be associated with the nephritis, myocarditis, and encephalitis. The commonest complication is the pneumonia. The chickenpox, it is a primary infection caused by varicella zoster virus. It may be occurring in the children or in adult. But children, it is mostly mild form. In adult, it is severe form with scar marks. Now, chickenpox in pregnancy. If immunized mother, infection mostly asymptomatic or very mild form. But it is a female or mother is not immunized. The severity of the infection depends on the period of pregnancy. If chickenpox occur in first half of pregnancy, 4 to 5 months of pregnancy, so that term is known as fetal varicella syndrome. If they clinically manifest in the fetus or it transmit to the fetus. Most of the children are asymptomatic, but those are symptomatic is also the severe form of defect, like CNS defect, which may be mental retardation, chorioretinitis, limb deformity, matlab there is a malformation, myocarditis. So that term is known as fetal varicella syndrome. The neonatal varicella and fetal varicella syndrome, it is a term we use depend on the clinical presentation in the mother. during the pregnancy. If the mother get the infection first half of the pregnancy, 4 to 5 months of pregnancy, and it transmit to the baby or fetus, it associates the congenital malformation, CNS defect, chorioretinitis, encephalitis. The term is known as fetal varicella syndrome. Neonatal varicella, when the mother gets the infection within a week before the delivery, within a week before the delivery, not more than 1 week. Again, if is more than 1 week, mostly the neonates are asymptomatic and no clinical presentation. Why? Because before the week mother get the infection, at the same time, along with the virus, mother transfer the antibody to the baby, and the antibody protect the baby from the viruses. So baby mostly asymptomatic, but the infection in the pregnant lady is get within a week, 2 to 3 days before the delivery. The baby receive only virus and not the antibody. So baby develop generalized infection, myocarditis, encephalitis, pneumonitis, and the term is known as neonatal varicella. Again, I repeat, neonatal varicella, it is the infection when the mother get before the week, within a week before the delivery, and baby receive only virus, no antibody, and clinical presentation with complication, pneumonitis and encephalitis, serious infection. It is known as neonatal varicella. And fetal varicella syndrome, baby develop congenital defect when they receive the infection from the mother, when the mother pregnancy is 4 to 5 months, and there is a mal deformity. Oh. Now, chickenpox is the primary infection, and the latent infection with the dorsal ganglia cell of the sensory nerves remain latent for lifelong. And reactivation of this varicella zoster result in the clinically distinct syndrome of herpes zoster. Clinically distinct means कि herpes zoster, the when we observe, it is in the one line. This is one line. Only this is the sensory ganglion here. They are present the latent infection in the sensory ganglion. Only one sensory nerve get stimulated. And what is the nerve supply to the body? This is up to the nerve supply, trigeminal nerve also, ophthalmic branch. So they may present as of the keratoconjunctivitis. But only one line, girdle-like lesions. So one line with neuritic pain, because inflammation of nerve. So severe neuritic pain and localized infection. Why localized infection? Only one nerve get inflamed, and they what is the nerve supply that area? These sites only get the disease. So clinically they disseminate, because in the chicken pox it is generalized infection, generalized, and in the herpes zoster it is localized infection. So the term is known as clinically distinct syndrome is herpes zoster. The chicken pox and herpes zoster caused by the same virus. That term is known as varicella zoster virus. Varicella means chicken pox, zoster means herpes zoster, and the name is the same. Varicella zoster virus. The varicella is a chicken pox primary infection. Reactivation term is known as herpes zoster. Zoster means girdle-like lesions in one line. Somewhere it's called in local language Nagin. So this is the reactivation in the adult type. That's herpes. Exact reason why the reactivation we don't, but it may be any stimuli. And mostly the commonest site, it is D3 to L2. This site is mostly commonly present in the presentation in the adult. Commonest sites are D3 and L2 and trigeminal ophthalmic branch. Trigeminal ophthalmic branch. These are the commonest reactivation site of chickenpox associated with herpes zoster. Chickenpox in the children, it is a mild form. Chickenpox is very common in the children. Adult is very rare, but it is severe form. Herpes zoster is reactivation. When herpes zoster patient comes in contact with new person, it develops chickenpox. Herpes zoster to no herpes zoster. Chickenpox to chickenpox, herpes zoster to chickenpox. Herpes zoster, when the new host, it is chickenpox. When primary infection is chickenpox, reactivation is herpes zoster. So laboratory diagnosis again to differentiate varicella zoster to confirm the etiology, to differ from the herpes simplex virus and other viral exanthemes. The specimens again we collect from the lesion, respiratory secretion in early phase, vesicular lesions, and oral ulcer. Microscopy is a similar presentation by as herpes simplex virus, Jang smear. Jang smear, toluidine blue stone, and Jang cells we observe in the staining smear. Jang cells, these are the multinucleated giant cells with faceted nuclei. Homogeneously stained ground glass chromatin is known as Jang cells. Second is Giemsa staining method. We can observe inclusion body intranuclear mostly. Intranuclear inclusion body, Cowdry type A body in herpes simplex virus and intranuclear inclusion body in varicella zoster virus. Immunofluorescence technique is very important role to differentiate, confirm the etiology, to differentiate HSV1 means herpes simplex virus 1, herpes simplex virus 2, and varicella zoster virus. Because here we use the antibody, it is a monoclonal antibody. The monoclonal, it is a target is a specific antigen present in the specimen. We prepare the smear from the specimen collected from the patient, and the specimen contains specific antigen. And we are using the specific monoclonal antibody, and that antibody conjugated with the fluorescent dye, auramine or rhodamine. The dye conjugated antibody attached to the specific target to the virus antigen, and it detect are attached to the virus antigen if they are homologous. And the immune complex, antigen antibody complex, the antigen antibody conjugated antibody with fluorescent dye, it complex we observe under the fluorescent microscope. In fluorescent microscope, background is dark, and the illuminated immune complex we observe if the antibody attached to the antigen. If antigen or that virus not present in the specimen, this monoclonal antibody doesn't attach to the target site, so we not observe illuminated structure against the dark background in fluorescent microscope. So if you observe such structure, we can say it is that antigen present in the specimen. So it is confirmed the etiology by microscope. Second is isolation. In isolation, it doesn't grow. Chicken varicella zoster virus doesn't grow in experimental animal and chick embryo. So isolation by tissue culture, cell line culture, and cell lines use mostly Vero cell line, HeLa, Henrietta Lancet cell line, and human amnion cell line. We observe by cytopathic effect, and again we detect it by immunofluorescence technique. Specimen inoculate tissue culture, it incubate in the incubator, and after some days, 1 week, we observe the virus growth. Virus growth by detect by immunofluorescence technique. Again, instead of specimen, we prepare the smear from the tissue culture bottle fluid or material. And again, we have the same procedure, immunofluorescence technique. Prophylaxis vaccine is available for chickenpox, live attenuated vaccine, and that strain is known as OKS strain. MCQ question. OKS strain live attenuated vaccine, 2 doses we give the children. One is after 1 year, and second dose at the age of 4 to 5 years. Vaccine is not protect confirmly, but the infection is get in vaccinated child is mostly asymptomatic, and in adult also, which is asymptomatic or mild infection. Thank you. Next video I will share on Epstein-Barr virus. Thank you.